Good afternoon, everyone. I'm Lovely, also known as the Lovely Coder, and today we're diving into a key component of inpatient hospital reimbursements MS DRGs, or Medicare Severity Diagnosed Related Groups. This system is the heartbeat of how hospitals get paid for the care they provide. Let's break it down. What are MSDRGs? MSDRGs are group hospital cases that are clinically similar and require similar resources. Think of it like organizing hospital stays into payment buckets. Each group has its own fixed reimbursement rate. The idea is simple: patients with similar needs, similar care, similar payment. This system helps ensure that hospitals are paid fairly while also encouraging them to be efficient and effective in the care that they deliver. The purpose of MA's DRGs is just to create balance. We want a quality care for patients, but also want to control the healthcare spending. So hospitals are paid a flat fee per case, not per day or per service. This puts the focus on outcomes, not on stacking procedures. It's about shifting from volume to value, a key part of modern healthcare reform. So let's dive into structure on an MSDRG. So each MSDRG is just based on a few critical pieces. So we have the principal diagnosis is the main reason the patient is in the hospital, any procedures that had occurred during the stay, and any complications or comorbidities, like things that make the case more complex. So let's say, for instance, we have a patient that has heart failure. If that patient has heart failure and then also have diabetes or kidney disease, they'll land a more severe diagnosis, which is your DRG, which means higher payment to match the increased complexity. So we're going to dive more into the what are the CCC and then also the MCC. The CCC means complications or comorbidity. MCC means major complication or comorbidity. These are what makes a case more resource intensive. So, for example, a patient with pneumonia who also has sepsis will be grouped in the MSDRG with an MCC. So, that is a staker patient, and hospitals need more time, staff, and support to care for them, which is why Medicare pays more in these cases. MSDRGs are the engine behind Medicare's Inpatient Prospective Payment System, also known as the IPPS. Hospitals are paid upfront, prospectively, based on the assigned DRG. Whether the patient stays for 2 days or 10, the payment is still the same. This pushes hospitals to manage care efficiently without sacrificing outcomes. This better they document and code, the more accurate the DRG and also the reimbursement. This is where we come in as the coders, warriors. We step in. Coders play a critical role in assigning the right MSDRG. We analyze the documentation, identify the correct diagnosis and procedures, and we also determine if there is any CCs or MCCs on there. One missing diagnose or incorrect POA status can change the DRG completely, and the cost of the hospital is thousands. So, yes, we are that important. MSDRGs are not just codes, they're clinical and financial tools and drive how hospitals get paid. When coders document thoroughly and accurately, we protect the revenue, support patient care, and reduce the risk of audits. So stay sharp, stay ethical, and remember, every code tells a story, and it's our job to make sure that that story is told correctly.